How do you define health literacy?
Health literacy is
health education.
It's power.
It's an important part of living.
We're talking about physical, emotional, mental, psychological, all aspects of health.
It's the ability to find, understand, and use information to make better health choices.
If you want to hang around and live your best life, health is something you want to consider.
It saves lives.
My name is Selene Lara. I am originally from Puebla, Mexico. I came to the U.S. when I was 16 years old. I left my family back in Mexico. It was hard to come to a new country and learn a new language. And since then, I've been trying to find myself. That's how I got to Carecen. Carecen is the Central American Research Center. It was founded back in 1981 to help the immigrant community fleeing from El Salvador. Since then, we've been providing community services. We also have a legal department that helps with immigration cases. We have seen clients who never seen a doctor before in their life. Clients who were always doing traditional medicine back in their home countries. They don't speak English, so when they come to this country, they don't know anything about how the healthcare system works in the US. And it's about information, it's about education. This is where we come in. So we started working with DC Health during the pandemic. There was a lot of misinformation, a lot of fear about, getting vaccinated against COVID. And then after that, the new arrivals came. They were coming on the buses from Texas. They were coming from different countries, different cultural backgrounds, and a lot of them had really serious medical needs. So with the help of the DC Health Advancing Health Literacy Grant, we created this program that was called the Resettlement Navigators Program that was providing health literacy to the families. We were doing workshops with them. We were providing them information on chronic illnesses, the importance of immunizations, and it was very successful. Later on, we added the mental health workshop because that was something that we saw the need for. We saw that they were keeping so many things inside, right? They were not able to share that with anybody else. They see themselves in us. I can talk about my own experiences, and they can talk about their own experiences, and they can feel comfortable doing that. We were learning from each other all the time. We were learning from each other's questions. When I think about the future of Carecen and the community that we served, I see that we still have a lot to do. I would like to have more workshops to bring in more people to be able to educate them. One of the things that I always told my class was, the knowledge that you are receiving today, I know it's not going to stay with you. I know you're going to share it with your family members, with your friends. We want to spread the message about health and the importance of health. To think about it that way, it always made me so happy and so proud about the work that we were doing. There's still many people out there who don't know anything about health literacy, that are afraid of asking questions, and we want to get the message to them, right? We are here for you. We're here to help you. We just need to find you, or you find us.
One of the biggest barriers to accessing health literacy is that one particular word, literacy. So we switched it a little bit and said health education, which gave it a more friendly and welcoming atmosphere. My name is Britton Sanford, and I'm the Health Preparedness Coordinator for United Planning Organization, also known as UPO. UPO is a nonprofit here located in Washington, D.C. that unites people with opportunity so they can become the key change advocates in their lives to help uplift themselves into economic security. We service a lot of low-income and underserved communities. So when we're going into these communities, we're noticing not a lot of representation in the sense of Black and brown bodies that have come from these neighborhoods that have this lived and shared experience. And so when you're able to present representation of someone that's from the community, for the community, by the community will come out. They want to trust. They're just not receptive to trust in everyone. The Advanced Health Literacy Grant is a grant that was funded to UPO from DC Department of Health that allowed us to go out into the community to promote health equity, to promote accessibility to healthcare and health literature pieces that help us build a health and wellness model that similarly ties in with the social determinants of health. We had a 6-week workshop on chronic illnesses and chronic diseases, and then we partnered with Far Southeast Family Strengthening and Collaborative to put on the Health and Wellness Expo. And we came together and we did that because we never seen a health and wellness expo specifically for Ward 8. We had over 27 health services registered. We had a numerous amount of residents come out, receive dental screenings, different health screenings. Some screenings they received was from George Washington, a MedStar Family Choice, and the list continued to go on. It was very successful, and we decided to come back to the drawing board and do it again. You never know what you're going to get on a day-to-day basis. Every day I'm in the community, I hear all these great stories, and I'm able to connect with each resident so I can know exactly what are the resources that they need, hearing from their point of view what's going on in their community because they live in these communities. I don't see what they see at 2, 3, 4, 5 o'clock in the morning. So hearing these stories and building a bridge and connecting them to the services is monumental because without the residents, we cannot do what we do. That is why I'm out in the community, and that's why I enjoy the work that I do.
Public health has always been an interest and a passion of mine. Helping people manage their health is something I really enjoy and is what got me into this work. My name is Jackie Rameld, and I'm the program manager at American University's Department of Health Studies on their Healthy Schools, Healthy Communities team. HEAL stands for Health Equity and Advancing Literacy, and it was a grant-funded project through DC Health. We had 2 faith-based partners with Urban Outreach and Pilgrim Rest Baptist Church, who would have pop-up events every single month and provide health literacy materials and information to the participants.
Health literacy is very important, particularly in our neighborhood, because there is a lot of health issues. My name is Reverend Will Stroman, and I head up a organization ministry called Urban Outreach. We found that there was a high number of hypertension and diabetes cases in our community. So with American University and HEAL, we put on many health fairs where we help people to make good decisions about their health.
He would have food drives every weekend, which brought in hundreds of participants. They would visit our station first and then move into the food drive, and we were able to make it into a big health fair event. And then with Miss Mary, she also brought in so many different community members and participants with her vaccine clinics.
My name is Mary Douglas Brown. I am the health coordinator at Pilgrim Rest. Jackie would come to all of our events set up, and whatever the awareness for that month, that's what they featured. So if it was skin, she gave them information on skin care. If it was on breast cancer, she did breast cancer.
Both Pastor Will and Miss Mary were a major part of the success of the program because of the consistent community members that they brought in.
We've seen so many people just come to understand new things, and you can kind of see them light up a little bit. They all just absorbed it and soaked it up, and we're very happy to take the information home with them.
I think we can inspire people to learn more about their health by getting involved in the community and meeting people where they are.
it's not just eating well. It's not just exercising. Being healthy truly is, having healthy relationships, being in a healthy community, spiritually healthy, having those areas as healthy as you can get them. You're going to be able to fulfill your plan and purpose for your life in a way that you would never imagine.
Good health means that you're living long. Bad health means that you're shortening your life. Taking care of your body, going to the doctors, eating right, drinking your water. Just the basic things that we don't do. If we know better, then we can teach somebody else to do better.
If we can just help a small group of people understand their health a little bit better and create better health practices, that's success.
You're not alone.